It's Mental Health Awareness Month, and according to the World Health Organization, 14% of 10 to 19-year-olds experience mental health issues. So joining us now is Boise School District Counseling Supervisor Jason Shanks and school social worker Gia Trotter. First of all, thank you both for being here and joining us here on the News at 4.
Absolutely. Thanks for having us.
You know, I think a lot of people are watching this. I mean, just how big of an issue is this when it comes to the numbers?
You know what, we had that same question in the beginning of this year. We really wanted to figure that out. So we thought, what do? We need to talk to students. So we partnered with Boise State University, we partnered with St. Luke's, and we had them come in and facilitate our mental health survey through our district, where we asked over 7,000 students that same exact question. What we found out with that is that 70% of our students, roughly, are doing really well. But there's 30% that are struggling, and they're struggling from anxiety, depression, suicidal ideation, a range of other things. So really trying to figure out how we can best support those students.
There's a lot of issues that kind of factor in this. And speaking of, what are some of the factors that play a role into this?
I mean, I think we can look at a couple really big ones, and we know that one of the biggest, of course, is that the result of living through this global pandemic, right? And so many of our students and families potentially needed services, and because there was such a strain on healthcare, mental health services, right? Students had a really hard time accessing that care. I think those were some of our biggest kind of issues that students were facing.
What are some of the signs out there to see if a student is struggling with mental health?
You know, that's a great question as well. I would say parents are typically the best person to know their student. And with knowing their student, they need to look for clues. And those clues could include their student isolating. If all of a sudden they're in their room more than they're out and about, that could be a great clue. If they are pulling away from things that they would typically do, that's another great clue. Other great clues are changes in grades, sleep habits, eating habits. Anything along those lines that's out of the norm, that's a great place to start a question with your student.
And we talked a little bit earlier, Jason and I are both parents of littles, and I know how chaotic my life gets, and we sort of realized that keeping an open line of communication with your student and with your child, no matter how the age, right, even a 6-year-old, I know that it's the first line of being able to help her is to just make sure I'm asking and engaging and sort of being available to her.
Just opening that line of communication,
yes,
if you will.
Absolutely. Yeah,
and I guess speaking of, I know there are so many resources out there. I mean, talk a little bit about some of those resources.
Yeah.
So I think when we first think about resources, we think about individual things we can do. But when we're really talking about resources on a larger scale, we actually look at the school as a resource. We know one of the most important things for students with mental health is connection, belonging, a culture. So we really want to encourage students to get involved, whether it's with athletics, music, clubs, anything within the school. We also know that's not enough.
And Boise School District has taken it on to create this kind of amazing program where we bring in therapists from outside agencies. So we've partnered with several community agencies to have over 20 different therapists in building that actually can provide one-to-one therapy to students during the school day, so we don't even have to worry about that access to outside. As well as Boise School District has partnered with BPA Health, and we've created there's a student and family assistance program where students and families are able to receive counseling at no cost.
Oh my goodness.
And so we've been providing that. It's been super, super successful for students and families to receive the counseling that they need and they've needed.
Yeah, what a great resource, because not only can they it's like a one-stop shop, if you will, right? They don't have to go outside of the school in order to get that help if need be. Is there anything else you'd like our viewers to know who might be watching right now?
You know, I just feel like in general, we're both really proud to be a part of a school district that spends so much time working on and helping our students. And I feel like we've really are doing a great job of recognizing that we can't just look at student mental health. We also need to look at staff mental health, right? When we see regulated and healthy and happy staff, we know that they will then be better, able and equipped to help and create healthy classrooms.
Yeah, it's twofold, right? It's really the students and the faculty.
Yeah.
Well, thank you both for being here. We really appreciate it. Thank you for joining us here on the News at 4, and we'll be right back.
Thanks so much.